Well, good morning. Welcome to McGee Women's Hospital. I'm Dr. Tony DeJoy. I'll be the course moderator for this morning. It turns out it's not a bad day to be inside in a nice air-conditioned auditorium, considering what's going on outside. But I'd like to welcome you to our ongoing Bone and Joint Health series. As you probably know, this has been a series that we started a few years ago. And actually, I'll introduce Terry Stars a little bit, but Terry and I actually started a conference pretty many years ago. And we started over at Shadyside Hospital, which was very similar to the kinds of things that we're going to do today. A couple of logistic things before we get started. First of all, we don't have any breaks built into the day. So if you do need to take a bathroom break, please feel free. We'll let you get everyone up for a little bit and get you moving. But we're not going to really take a break because we have a pretty packed schedule, and we found that everyone really likes the question and answer period towards the end, so we try to save as much time as we can for that. So please feel free to get up, and the restrooms are in the back corner over there on this level as you go out the door. Second thing is this auditorium is a very, very pretty, nice auditorium, but there's two areas you have to be especially careful. The first row here and the first row up in the back, because there's a step off right before, right as you get up. And we don't want anyone to fall. None of us want to do any work today. But please be careful, especially when you get up for the breaks or just take a little break. Now, the focus for today is the question posed is why live with painful hip and knees or osteoporotic bones? We have a very nice program. It's a mixture of all the care providers that look at musculoskeletal problems. In that we have rheumatologists with Dr. Stars, myself and Anton, who are orthopedic surgeons, and Megan, who actually runs our gym and our inpatient physical therapy program upstairs too. Because as you know, exercises is important for healthy joints and bones as far as the treatment of osteoporosis. And as I mentioned, we do have a special session at the end for a question and answer period. Now, what we do for that, so that we can try to get as many questions in as possible, everyone should have received a card, an index card. Now, the index card is to be used to write your questions down as you think of them, as they come up during the course of the morning. Okay, and so we're not going to have a question and answer period after each speaker, but as you think of questions, write them down. And then at the end of the didactic portion, we will collect all those cards and organize them, and then I will be using those cards to ask the panel questions up here. So that's the way the question and answers work. So please write your questions down as you go. And please, I have to wear reading glasses now too. So please write big. It makes it easier to read them, especially when it gets a little dark in here. Also, at the end of the session, remember, we're going to keep the exhibits open, so you could revisit the exhibits. And also, if you wanted to, you can also take the opportunity to take a tour up on our floor, which is a special, what we call wellness unit, which is we designed a little differently than most inpatient hospital units. So if you want to, that's going to be an opportunity at the close of the lectures. Oh, and I forgot about your surveys too. As I mentioned, this is an ongoing lecture series, and we really appreciate when you write comments about what's good, what's not so good, and also about suggestions for future topics. So we take those surveys very seriously, and I've changed every program that we've had based on the suggestions from you. So please fill those out as well, and on the way out at the end of the day, just hand them back into the front to the front desk. A couple of things we've been developing for those that like to get on the internet. We do have a new blog that we've been developing now for about 6 months. It's in your packet if you want to go visit it. It actually we're probably up to 20 topics already that we've posted there, and it covers the whole spectrum of arthritis and surgery and post-op questions that come up from patients, as well as some other issues. So please feel free to go there. It is a blog where you can leave comments too, and we do try to get back to you about your comments. We also just kicked off a new program here in McGee and in the outpatient section, and in a volunteering program. And again, this is in your packet. Initially, we've targeted some of our post-op patients because they've been through the experience, and it is always nice to talk to someone that's been through the experience. But there's two different ways to volunteer. We actually have on-site volunteers that Janice Harmon, who is our coordinator, I don't know if Janice is here tonight. She may be out front still. Janice coordinates our volunteer program, but you have the two ways to volunteer. One is we do have on-site volunteers that help up on the unit, up on the floor, but also we're developing what we call an orthopedic voice of experience, where people would volunteer to talk to patients either by telephone, internet, or other means to just communicate with each other, because we always did keep a list in the office of patients that were willing to talk to patients that were thinking about surgery or had arthritis and those kind of things. But we're trying to broaden that now, so to create literally a community that would be willing to talk to each other about what it means to have arthritis, what it means to have surgery, and what happens after surgery. So keep that in mind, with two different ways for people to be involved. Our sponsors, first we have our AMD3 Foundation. It's our educational research foundation that does sponsor all of these kinds of community outreach events, as well as Magee Women's Hospital in our practice. Magee, as you know, is a beautiful hospital. How many people have either been born here, had a relative that was born here, or a grandchild that was born here? Raise your hand. It's pretty amazing. I think every time there's 90% of the audience has some connection in some ways to Magee, and it's a very nice atmosphere, as we'll talk about later, to develop the kinds of programs that we're developing, focusing on health and wellness. And again, our supporters, they're our exhibitors out front. Please feel free to visit them and pick their brains, and I know they have some giveaways for you too. We're very thankful for their involvement, because they do add a facet to the program that we can't do ourselves, for sure. As I mentioned, this is an ongoing series. So please, the dates are in the program. We actually started what I call home and away kind of conference series. We had our first away one in Monroeville in June, and we're actually going up north to the Pittsburgh Marriott in Cranberry in our December session, and then we'll be back here in February. So we're sort of trying to alternate places to do more of an outreach. And also, we'd like to go west and south as well. So if anyone knows of areas or places where we can give this kind of event, please write that on your survey. As you can see, we need sort of a big area, so we're limited to where we can go. But if you know of any area, community center, we had ours at the community college in Monroeville, which is a great site. Just write it down in your survey, because that would be very helpful too. And that also brings us to the Patient and Family Advisory Council. Again, Janice Harmon, one of the nurses in our program, started this as a way for patients to provide us with advice on how to develop our programs. And it's been a very active program, almost for a year now. And we have 4 patients with their spouse that's involved, because as you probably know, in our program, we view this as a patient and family experience, not just a patient experience. And it's all we, in our program, require everyone to have a coach to go through the program together. Now, as part of that, we're fortunate, one of our founding members of the advisory council is LaDonna Bates. And LaDonna has agreed to present to you her story of what it means first to have arthritis, but also what it means to go through a surgical process for arthritis as well. LaDonna will certainly share her experiences with you, but she's also a professional writer, and on my perspective, has been very helpful, because I've bounced some of our articles off of her, and she's been able to review them and write them. And having a patient that has gone through the experience review those kinds of things is basically invaluable. So with that, I'd like to ask LaDonna to come up, and she will be presenting our first talk today, A Patient's Perspective on Arthritis and the Treatment. LaDonna?